I'd like to introduce our final speaker for this afternoon, who brings another crucial perspective to this conversation. Jennifer Gourlay is a primary care nurse and RN authorized prescriber at Norwest Co-op Community Health Center in Winnipeg, Manitoba. With over 20 years of nursing experience, Jennifer brings strong clinical insight and a deep commitment to community-based care. Her work focuses on reproductive and sexual health, harm reduction, and outreach, helping to make health services more accessible and equitable. Through RN prescribing and frontline engagement, she supports vaccine promotion and trust building across diverse populations. Passionate about collaborative and person-centered practice, Jennifer brings a grounded, practical perspective to advancing vaccine outreach in her community. Please join me in welcoming Jennifer.
I'm just going to do a land acknowledgement. So that Norwest Co-op Community Health acknowledges that we operate our services on Treaty 1 territory, the traditional lands of the Anishinaabe, Cree, Ojibwe, Dakota, Dene, Oji-Cree peoples, and the homeland of the Métis Nation. We also acknowledge that in Winnipeg, we receive our water from Shoal Lake 40 First Nation, and we express our deep gratitude for the sharing of this essential resource. We respect and acknowledge the harms and mistakes of the past and the present, and we dedicate ourselves to collaborating in partnership with Indigenous, Métis, and Inuit peoples in the spirit of reconciliation. So just a little bit about Norwest. We are a health co-op, and we've been in operation for over 50 years. We are the only health co-op in Manitoba, and that allows community members to buy membership. They can be elected to the board and have a say in how we run our services. A little bit more about Norwest Co-op. I'll just finish this off quickly. This is our building here. We live at Access Norwest, and it is a 3-partner organization that serves as a local hub for healthcare in the Inkster community. We're in the northwest corner of Winnipeg. Working with our partners in the building are Winnipeg Regional Health Authority, Public Health, and the Manitoba Government Department of Families. Makes us uniquely positioned to provide primary care, public health, education, and outreach under one roof. We have a very dynamic and collaborative work site with many joint initiatives, committees, and as well as a joint reception area, which allows us to meet our clients and community members and overall health needs based on an understanding of the impacts of the various determinants of health. Next slide, please. So we engage our community to provide services that allow people to take control of their health by using a harm reduction approach and working to impact the determinants of health for them and the community. We do this through family medicine and primary care, our walking connected clinic, our allied health team and my health team partners, chronic disease management, health promotion, foot care, mental health, social work services, teen clinics, and so many other programs. We partner with our resource centers and other programs like our community food center, Huddle for Youth, and our Bright Start programming as well. So the area that we do serve, sorry, next slide, Aisha. It's a good total population of about 37,000 individuals, with over half of them being of visible minority, primarily Filipino and South Asian immigrants and newcomers. Our Indigenous population is about 16%, which is comparable to 12% for all of the city of Winnipeg. We do have a structurally marginalized and racially marginalized population, and an above average number of families living below the poverty line. And the median age in 2023 was about 38.4, so on par with Winnipeg, roughly 39%. Okay, next slide. This is our neighborhood. You might have to click a few times, Aisha, to bring up all of the places. So very much in the middle there with a happy face is our access location as our main site. And you'll see the various resource centers that we have around the community. So our community food center, our resource center at Gilbert Park. We have our Huddle for Youth, Norwest. We also have a satellite location called Bluebird Clinic. And so it just allows us to work closely with, different schools, workplaces, and other partners so we can respond to different needs in the area. Okay, next slide. Our vaccine strategy at Norwest. We all know that that's the most effective way to prevent flu and severe respiratory illness. So we start our planning months in advance, ensuring we have enough supply, various vaccine supplies, we have enough staff, and developing our clear messaging for protecting ourselves and the community. We often use the Winnipeg Regional Health Authority's materials and posters inside the clinic just to keep the messaging consistent through most of the facilities in the city. Our clinic has a 7.2 EFT nursing complement between our two main sites, Norwest and our Bluebird Clinic. And we do most of the prep work ourselves. Um, you know, the relationship building is the key to what we do and to prepare and our vaccine um, uptake. Um, Cultivating trust with our primary care clients is integral to just addressing vaccine hesitancy and increasing that uptake. We also have a community development team at Norwest. They're very strong when doing vaccine outreach and that relationship building. They do work daily with our community members to develop and maintain those relationships and build trust. So those are two of the relationship building and trust are two of the keys for that. Next slide. Another part of our strategy is accessibility. A lot of our community members struggle with transportation. So we work really hard at making sure that vaccines are accessible to increasing that uptake. And of course, as Cliff had mentioned, right, the role of pharmacies have now also helped with that. But ourselves as a clinic, we do have walk-in appointments. We have extended office hours, so we're open from 9 till 8 p.m. We're also open on weekends. And we also bring vaccines directly to the community through home visits for those of our primary care clients who are in need of that. We hold workplace clinics at different workplaces in our catchment area, as well as pop-up sites at our various resource centers. During the larger vaccination campaigns like the one with COVID, we did use community centers as well to meet that demand. We work actively to remove barriers for most folks. Like I mentioned, transportation, bus tickets, home visits, that kind of thing. Child minding is another issue. We saw that quite a bit with COVID. And our community development team will provide child-friendly activities so parents can be vaccinated and wait that 15 minutes after. We also have offered free lunch by partnering with food trucks like Indigenous Kitchen. Their Bannock Burger is amazing, and Caillou Bistro. We've also partnered with another City of Winnipeg program, the Wrench program, and it helps with bike repair and kids' bike giveaways. So that was really popular. We employed that during COVID. Next slide. So education and promotion are just as important as that access. No one will come if they don't know you're there. We use social media, posters, newsletter to get the word out. Our community development team staff at each of our resource centers are integral in also promoting our vaccine outreach clinics that we use at those centers. During particularly bad flu seasons and during our COVID immunization campaign, they were actually going door to door to speak with community members to provide clinic dates, locations, and address any questions that they had. We've also participated in various Q&A sessions with community partners to address hesitancy. This was more prevalent during COVID vaccination, where we do regularly host a variety of Q&A sessions at Seniors Housing Complex, where our satellite site is located. And then we also offer, next slide. Yep, there we go. Our health box to promote flu vaccine and promote our clinic. So our health box is a smart vending machine which provides low barrier access to free HIV and HIV self-test kits and harm reduction supplies, sexual health supplies, condoms, lubes, pregnancy tests, and a lot of educational information. Just a little plug there for that. Oh, and it also has an integrated map of the nearby community resources and services for harm reduction, HIV, and shelters, etc. Next slide. So, of course, this work wouldn't be possible without our internal and external partnerships. We work together with the public health nurses in our building to increase accessibility and uptake of all vaccines. Additionally, some previous joint endeavors with our neighboring community of Seven Oaks has led to a lot of helpful working relationships with the public health team there. And then, as I previously mentioned, working with our community development team is another one. When we were working with them on the larger COVID vaccine mission, it was really a really positive side effect of that endeavor. We had a lot more projects and a lot stronger collaborations afterwards. And even just their presence at any of the vaccine clinics, they're a familiar face. They were assisting individuals with completion of their consent forms. And it just makes everything more welcoming, safe, and comfortable for community members. Next slide. Excuse me. So we also share a lot of prevention messaging, encouraging hand washing, masking if needed, staying home when sick. We use our social media for a lot of that. We I think that part of it is missing. I'm just going to add, during COVID, we partnered with a young community member who was gaining a TikTok following about using a lot of prevention messaging in his TikToks. And so we were able to connect with him and reach out with him and make some joint videos, which was a lot of fun. So we also have a nursing triage line, which allows our primary care clients to ask health questions over the phone, and it can prevent them coming into the clinic unnecessarily. Our primary care providers also offer virtual telephone visits, and our walk-in connected care clinic has online bookings available to reduce time in waiting rooms. Next slide. So as mentioned in the other presentations, that vaccine hesitancy, myths, and misinformation right now is our biggest challenge to getting more individuals vaccinated for flu. We notice pneumococcal has a good uptake in our experience in the office setting and at flu clinics, but individuals are still hesitant about the flu shot. So we do a lot of education and just a lot of talking about, what the flu shot is. Internally, of course, staffing shortages are one challenge, but probably competing demands are the biggest challenge of all. Finding time to create all the publicity and promotion required for a successful campaign is difficult. Though I will give credit to our management team for their buy-in, definitely, and they're very accommodating for our requests and our needs.